Want to talk House Bill 3610 Task Force on Alcohol Pricing and Addiction Services. We're here. Adam, can we do a roll call, please?
Senator Solomon.
Excuse.
Senator Knopp. Chair Sanchez. Representative Reschke. Okay, let's come back to that. Chief Doug Barrett.
Yeah, is there a reason why we can't see them? We usually are seeing them on the screen.
That's because I've spotlighted us.
Why?
Here, she can change your presently.
Yeah, exactly.
Okay.
Alrighty. Bonberry. Rob Corbett. Here. Annalise Dahl. Jamie Floyd. Here. Dr. Tom Jean. Here. Todd Jeter. Here. John Colmer. Here. Sarah Lochner.
Here, there we go. Thank you.
Jana McCamey.
Here.
Director Prince.
Here.
Marcus Reed.
Here.
Jason Renaud. Danelle Romaine.
Here.
Valera Salazar.
Here.
Aaron Sarnoff Wood.
Here.
Quorum is present.
So, again, is there any discussion or question about the work plan?
Just one note, I got a text from somebody who's joining remotely and said that the link that is embedded in, you have to put the link on the embedded, in one, the one in the agenda, not the one on the webpage. The one just outtakes this here.
Okay.
That might be where some of the folks are
Thank you.
hiding.
Again, any questions, discussions, or concerns about the current work plan? Okay. Feedback from members about OHA spending and data review.
I think Erin is going to put that off for now. You can get through the agenda.
Thank you so much, Erin. I appreciate that. Okay, well then let's just get rolling here. Year one in Cider's relationship with Oregon Hospitality and Economic Contribution of the Year. God, that's really weird. The economic contribution. Year one in Cider to Oregon's restaurant. I read it all too fast together. I'm too used to reading too fast these days. All right, Greg Astley, is that you, sir?
Yes, it is.
Director of Government Affairs, Oregon Restaurant and Lodging Association. Feel free, sir.
Thank you, Chair Sanchez. You kind of stole my thunder, but for the record, members of the task force, my name is Greg Astley. I'm the Director of Government Affairs for the Oregon Restaurant and Lodging Association. And in no way do I take it personally that there's reduced attendance at this task force. I'm strong enough to understand this.
Thank you. Technology has been supporting us regularly these days.
It's beautiful weather out. I understand people, it's tempting to not show up for a meeting, but The Oregon Restaurant and Lodging Association represents almost 13,000 food service and lodging establishments across the state of Oregon. Our industry is the second largest private employer in the state behind healthcare. We have approximately 11% of the total workforce in Oregon. As of December 2023, the Oregon Employment Department reported that leisure and hospitality workforce totaled 208,700 people, with a total economic impact of over $13.8 billion in annual sales for Oregon. 97% of restaurants in Oregon have fewer than 50 employees. Restaurants really are the cornerstones of our community. It's where people come together to eat, to socialize, enjoy the culture of the community. It's a place to celebrate birthdays, anniversaries, catch up with old friends, celebrate a Little League championship, and make lasting memories really with a special someone. The restaurant and lodging industry remains important for people wanting to enjoy new experiences in Oregon, but it is an industry that continues to face real challenges. Overhead costs continue to increase across the board, whether it's minimum wage hikes that go up every year on July 1st, other labor-related expenses, the rising inflation that impacts food, rent, utilities, and fuel costs, or the increasing swipe fees on credit card transactions. Finding employees is still a challenge for many operators who can tell you about the numerous times that they've set up interviews with prospective employees, only to have no one show up and to be ghosted. None of this includes the challenges that restaurants and lodging properties are facing from the annual wildfires, ice storms, and continued violence and vandalism against businesses in our urban areas. And although customer counts and revenue are both up, for some restaurants, profits are down. On average, restaurants have a profit margin of approximately 3 to 5%. That means 95 cents out of every dollar that comes in the door goes back into the people, the food, and the place. The increased costs and inflation, though, have taken a heavy toll on those margins. As I've traveled around the state doing regional meetings with our members, we've had conversations with restaurant owners about their businesses, and a growing trend has emerged. And that is that managers and many tipped employees are taking home more money than the owners as they struggle just to contain costs and remain in business. Increasing the tax on alcohol would be another obstacle to overcome for restaurants and lodging properties who serve alcohol to guests. Visitors come to our great state to enjoy the incredible scenery, unique attractions, and enjoy our world-renowned food and beverages, including the craft beer, wine, cider, and spirits. Oregon's reputation among foodies is well known, well deserved. Adding another unnecessary tax and an expense will impact not only our ability to serve those guests and visitors, but will significantly strain already tight budgets and may force some operators to close their doors. Sadly, in the last several years, we have already lost hundreds of restaurants and lodging properties because of the pandemic and its lasting effects. Many of those are probably names that you recognize that may have even been your favorite community restaurant. Those who have managed to stay open are still struggling financially. In some cases, they're still paying off loans that they took out to keep employees on the payroll and continue to serve their loyal customers through the pandemic and beyond. We recognize Oregon has a substance use problem, but the solution is not more money. It's planning and prioritizing the care for those impacted by this issue. Alcohol generates more than $17 billion in economic activity in Oregon and is still the third largest source of revenue for the state at $629 million. Yet only 3% of that revenue goes toward funding mental health and drug addiction recovery and treatment. The rest of it goes into the general fund. If you want to help those affected by drug and alcohol addiction, you should recommend that the legislature reallocate more to prevention, recovery, and treatment, rather than putting nearly all of it into the general fund. Hundreds of millions of dollars are already available, but we now need to work together to ensure that these resources are utilized in a coordinated fashion and are based on evidence-based treatments with accountability from providers. Oregon's hospitality industry cares about its employees, its guests, and the people who run the restaurants and lodging properties across our state, some of whom also struggle with substance use and need help. But instead of threatening their livelihood by increasing taxes on alcohol for money that's not needed, let's focus on prioritizing putting the money we already have for proven methods of prevention, treatment, and recovery with accountability. Thank you.
Thank you. Questions? Okay, can you unspotlight us, please, Adam? It's very nerve wracking to see the back of my really gray hair.
I thought I had.
No, you didn't.
For some reason it just stuck. Try that again.
Right? Okay, because I can't see if anybody, oh, I do see one hand up, there you go. Rob. Morgan.
Yeah, thank you. So I just wanted to ask Greg, you mentioned that 3% of the tax revenue that comes into the state of Oregon goes to treatment and the rest of it goes into the general fund for the state. Can you cite where you got that information?
Yes, members of the task force. Let's see here.
I think what that's well, the data that they present to the legislature.
Yeah, I can. Rob, it's Craig Prince. Can you hear me? Okay.
Yeah, I can hear you.
Yeah, so I think what Greg referring to, excuse me, is, we'll get into this in detail, but the distribution of the revenues from alcohol, so it'd be the alcohol markup from the distilled spirits and then the privilege taxes and all of that combined. It then is distributed 10% to the counties, 34% to the cities, and a small 3% is to the OHA Mental Health and Addiction Fund. Then the remainder of it goes to the general fund of the legislature, and the legislature makes the appropriations. So certainly there's some of that goes into, money from income taxes, alcohol taxes, lottery taxes, everything is pooled, and Rep. Sanchez, of course, is the co-chair of Ways and Means that balances all of the needs of citizens of Oregon that they need from their government. And so it's right that only 3% is, I would use the term earmarked or targeted at that. But as we heard from the counties use some of theirs. It's unrestricted. It's local decision-making at the city level and the county level. And then it's the legislature through the Ways and Means process who targets that money. So I would say it's correct that that's the money that's targeted, but it's also correct that the alcohol tax goes into, with all of the money goes into cities, counties, and the state coffers. And certainly a portion of that is spent on behavioral health treatment and prevention. So I hope that makes sense.
Thank you. Thank you, George.
Thank you.
And I do want to be very, very clear, that, however, though, that as I have stated many times, unfortunately, you've not been here through the whole time, so I've stated many, many times that Oregon is a unique animal. We do not have a sales tax. We do not, we have a kicker, and we have structures in the state that were designed to determine how we use certain pots of money. And so therefore we have maybe not the best ability to use our resources in the best possible way. So resources that go into the general fund are required to support everything. And so, I often tell our finance people at my real life job that pays the bills that do my job for a minute and we'll figure this out. I can show you where the money is. The running of the state really does. We built this system like this. We built a situation where alcohol does fund a lot of the general fund because we don't have a sales tax and because we have a kicker. So there's a little bit of a balance and nuance to just identifying 3%. So, yes, sir.
One question for the refund, as I understood it was last year, the refund, because we operated in a surplus. What was that dollar value? Do you happen to have that figure?
5.6.
5.6 what? Billion was the refund. That's how much we got.
That was the kicker.
That was the kicker. Big number.
It's a huge number.
Okay.
Yeah. Trust me, we could get rid of that bad boy. I would be happy. Yeah.
This is Jamie Floyd, and not necessarily for now, because it's probably a larger conversation, but for those of us that are not that deep in the process, it would be good for us to know the limitations for a body of government to not change that 30 or 40 years later, because it obviously that wasn't a part of the original constitution or whatever. So I guess, again, that doesn't have to be for now, but it's something that I've been curious about.
That is the will of the people of the state of Oregon. Oh, sorry.
Yeah, I guess one more. Oh, I've never actually seen a ballot in the 40 years that I voted in the state that asked me what I thought about the kicker. So I guess that's.
That's because it's very unpopular to take somebody's money.
Oh, no. No, I know all of that, but I'm just sort of airing that part of it because I hear that it's the will of the voters, but I've just not seen that whole, like a literal election poll done on that. So thank you.
Yeah, it's a little tough. It's a little tough right now. Dr. Jean.
Thank you, Madam Chair. Yeah, Tom Jean, OHA. Just wanted to, for this brief discussion here, just wanted to remind the task force. We heard, I think it was the last meeting from the League of Oregon Cities, who really highlighted how much cities are having to spend on public safety. And there's a lot of, alcohol is a big contributor to that. And I think that's one of the biggest places that the OLCC alcohol money goes. So even though it's going into general fund, a lot of it is going to alcohol already.
More questions? I should be looking at my English screen.
I just want to thank you, Greg, for speaking about the relationship between the sector
And your name is?
Denell Relane Airline Distributors.
Sorry, just so, Mr. Astley, we ask people to say their names as they're speaking because the folks online actually can't always hear or see us, of course, so.
One of the things that we've heard is that by increasing alcohol taxes, a restaurant that really is just trying to stay afloat, they'd have to actually increase food prices in order to, make it work for them to stay in business. Is that, have you heard from any owners about how they would, shift costs in order to stay afloat in that situation?
Yeah, Chair Sanchez, from the alcohol has a higher profit margin for a lot of restaurants. And so if you increase the tax on that, you have to increase the prices either on your alcohol or your food to make up for that. Again, everything's going up. There isn't a cost center for restaurants right now that you can say has stayed flat or gone down, period. And so as people have less disposable income, as they're making choices about where to spend that disposable income, it becomes very difficult to compete with everything else out there. You can only charge so much for a burger. You can only charge so much for a pizza before people start realizing that it's not going to be worth it for them to do that. And that's when we continue to lose more of our restaurants and out of those communities. So yes, absolutely. We're very inclined.
And I think the sad reality is, as was mentioned, everything's going up. Not, there's nothing in a restaurant sort of pricing that stays stable. There's nothing in anything, in any industry that is staying stable. Everything is going up. So we are in obviously in an inflation mode. We are in a hiring crisis for bodies in the room, as you mentioned, for every industry that and all of them talk to me. Like every industry, we are in a moment in time when things are changing. And the question here is not just about one tax or the other. There's a plethora of things that have to be shifted in the way we do business here in the state, and we have to figure that out.
Chair Sanchez, I couldn't agree more. You mentioned that we built this system, and I would say, I guess it's time that we take a look at how we can fix the system now. From the ground up. I would also just, point out that many other industries do not have the very, very low profit margins that restaurants have. 3 to 5% is really, like I said, kind of the average. And anytime you increase the cost going out the door, you decrease that profit margin. And so most industries do not have that thin of margin.
Oh, I'm sorry. Laura.
I would just like to share that the addiction treatment industry in Portland, Oregon has a profit margin of about 0.5% to 1%. So if you're ever feeling bad about your 3 to 5, you can jump on our side of the aisle. It's a little rough over here.
Right. Also, very similar in terms of pay scale and wages and stuff. Very, very, very thin right there. Okay. Other questions, comments, concerns? And paying attention, put your hand down tomorrow. Oh, Sarah Lochner.
Thank you. Sarah Lochner, Coalition of Local Health Officials. So as a former restaurant employee, as a person who enjoys restaurants, and also as a consumer of restaurant goods who pays $10 to $15 for a glass of wine in a restaurant, I find it hard to believe that if you increase that price on the menu from $10 to $11 to accommodate for any tax and give yourself a little extra boost on top of that. I mean, I just find it hard to believe that consumers would opt to not have that glass of wine or not patronize your restaurant because of that modest price increase. To me, it seems like a win-win for both restaurants and for prevention and alcohol treatment if we can find a place to meet in the middle that is both reasonable and addresses the problem we're trying to solve here. So I'd love to hear your comment on that. Thank you.
Yeah, Chair Sanchez, Ms. Lochner, a 10% increase is a 10% increase. And again, you can only charge so much before people start turning down those items. We're reaching a point where prices are getting to that, I guess, not to use the phrase tipping point, but it's difficult for people to continue to go out and patronize restaurants if they don't feel like they're getting that value. Again, I would argue that it's not about needing more money. It's about reallocating the resources that you currently have. Anytime you're going to be charging more money to restaurants, or restaurants are going to have to be paying out more or charge more, you're going to lose customers. That's just the reality of the situation. So it's difficult. That's why we have a lot of restaurants that don't make it. And any added burden to them is only going to increase the chances of them closing their doors.
I can appreciate that. And to just be, I mean, I understand that the concern or the thought about how the state distributes its resources. It's a huge, huge issue. But I will just maybe put a finer point on it and recognize that in the legislative session, not this last one, that was the short, in the long session, there were about $2 billion more in apps than the state had available to distribute. So, yeah.
And Chair Sanchez, restaurant operators have to deal with that every single day. We don't have the ability to just go out and print more money either. So we have to make tough choices about where do we make cuts, whether that's in employees or whether that's in amenities. You can't pay for everything. We'd love to, believe me. And I know the legislature and other governments face that as well. But the bottom line is sometimes you have to make difficult decisions.
Which we have.
Yeah.
Well, thank you so much for coming and talking with us. And I do appreciate the perspective. I really do recognize, the economy of the state of Oregon is hugely important to me, and how we move any resources and keep people employed, keep people living here in the state of Oregon is hugely important. And balancing it all out is really going to be a hard thing to manage.
Absolutely. Thank you for the opportunity.
Yeah. Thank you. Okay, so who do we have next? Oh, everybody. Danielle, Karen, Jana, who's going first?
Aaron is going first, and Jana and I will pick up at the end.
Okay. What you got, Aaron?
If you guys see that up there, perfect. And this is the control at the power.
Yes.
All right. That's a He-Man reference for 90s pets.
Missed it. Thank you.
Anyway, with that note,
One moment.
maybe. There we go.
Okay, it was stuck on Teams.
Stuck on
You
things?
should be good now.
There we go. Look at those kids. So, I want to start by saying thank you for the opportunity to speak with you today. My name is Aaron Sarnoff. I'm one of the founders of Two Towns Cider House. I love working in the alcohol industry because in this industry, it's possible to create something from truly humble roots. I started my journey with my childhood friends at the ripe old age of 27. We had a dream and not much else. We launched in a garage armed with YouTube tutorials and a lot of duct tape. We grew up here in Oregon with a number of farming families, and so we sourced our fresh pressed fruits from them. We now have grown to consume more than 45 million pounds of Oregon and Washington grown apples every year. Apples that would have been discarded if they had not found a second life as cider. We also are one of the state's largest consumers of fresh Oregon blackberries, blueberries, strawberries, and raspberries. We may have started small, but we have grown to become one of the larger craft producers in the nation. We now employ 130 staff. We care about our people. I would wager that our team has better health coverage than almost all state employees, and that includes access to recovery services if they need them. As a business owner, I'm well aware of what that costs. I care about Oregon. I grew up here. It's my home. I've seen the state change over the years, and not always for the better. Increasing home prices, inflation, a lagging economy have all forced thousands onto the streets. COVID has exacerbated the situation, and Measure 110 brought drug usage from behind closed doors out to the open onto our street corners. It is with this in mind that I've looked for solutions that bring access to recovery services to those in need without further damage to our fragile economy. With over 100,000 people working in my industry, I care for them too. I've spent hundreds of hours researching addiction recovery over the last years on my own time so that I could be useful in this conversation. I've reviewed scores of medical studies and tax records, interviewed dozens of professionals in healthcare, insurance, economists, behavioral health specialists, lawmakers, and of course, people in recovery. It is from this research that I prepared the following presentation. So I want to start our conversation talking a little bit about narrative. A couple of years ago, we were talking about House Bill 3312, and that was an extreme proposal to increase alcohol taxes. And that was being debated, and if it had passed, it would have been catastrophic to our industry. I spoke with several lawmakers at the time and asked, who would voice support for this bill? Why do they support such an extreme increase in my taxes? And among other materials, all of them referred me to this same article, Addiction to Drugs and Alcohol Deepens in Oregon, report shows. Now, the Oregon said Oregon was last in access to recovery services and second worst in addiction rates in the nation. Only that wasn't true. The article made a number of assertions based on flawed data and an improper analysis. So I got to do it on both. There we go. Here, you can drive me here. All right. The data that article relied upon was the National Survey of Drug Use and Health, specifically the 2019-2020 survey data. Now, the National Survey of Drug Use and Health every year interviews people all across the country, including in Oregon, about their drug and alcohol use behaviors. And from that survey, they're able to derive statistics, including rates of substance use disorder. Now, this particular data set is really important because in 2020, the National Survey of Drug Use and Health changed their methodologies. They changed the way they estimated the number of substance use disorders. And that change in methodology made the number look much bigger, in fact, double. And what this article had made, the mistake this article had made was it was comparing 2019 data using the old methodology to the 2020 data using the new methodology. And from that had concluded that we were in an addiction epidemic, that we were seeing skyrocketing rates of substance use disorder, when really we were seeing a change in methodology, not a change in behavior. Now, this became such an issue that the National Survey of Drug Use and Health retracted this data. It is deemed unusable. If you go to their website today, it has a disclaimer that says, do not use this data, it is unreliable. I contacted the author of the article and asked for a correction, and ultimately was ignored. For the next year, if you Googled Oregon and addiction, this article was the top search response. And in fact, Google took an excerpt from this article, and it was the Google facts, above that looks like it's coming from Google. When Google says it, it's true. So around the same time, I started doing other research, and I found scores of other articles, all making the same conclusions, all reliant on the same flawed data. And what I also saw was that the majority of these articles were citing Oregon Health Authority and or Oregon Recovers. And while I don't necessarily fault journalists for not fully comprehending the nuances of public health data, I am concerned that Oregon Health Authority should be aware of what this change in methodology meant and why the conclusions that they were drawing would thus be improper. And, where was I? So together, these articles, in chorus, were the foundation for what I believe is the addiction epidemic narrative. And, that narrative was causing lawmakers to potentially support a bill that would have resulted in thousands of people losing their jobs and potentially hundreds of millions of dollars of damage to our economy if it had passed. To date, I've not found any corrections on this particular topic, and so the narrative persists. And narrative drives public opinion, which in turn drives public policy. So fast forwarding a little bit to today, we've been told that Oregon is desperately in need of addiction recovery capacity. At our first task force meeting, OHA presented that Oregon was 49% underserved by our current capacity, and that we needed 3,800 more recovery beds. This also was widely publicized. What I did not see publicized was the following, and that was that Oregon Health Authority has never physically checked what our capacity is. Oregon Health Authority has no data on patient wait times, how often our beds are filled or not, or differences in service between Oregon Health Plan patients and those having private insurance. So you might ask, if we have no data on what our usage rates are, how do we come to this determination that we are lacking in capacity? And that claim comes from this document, the Gap Analysis Report. Now, the Gap Analysis Report was contracted by OHA to make a theoretical estimate of what our recovery demands might be given a number of data inputs. And those include some demographics data and the rates of substance use disorder in the state of Oregon. And from that, this equation tells us how many beds we need. Now, this report never actually looked at our current usage rates in the state, and it never actually surveyed any statistics relevant to what is actually happening. It is just a theoretical model. Now, again, there was a couple of issues with this particular report. One is that the survey data that it relied upon for our substance use disorders was the retracted 2020 NSDUH survey data. And I believe that that data was chosen specifically because that was the year that we saw the new methodology. And that new methodology showed a doubling of substance use disorders from the prior year using the old methodology. And because the gap analysis method, it is a math equation. And if you give it more SUVs, it tells you you need more beds. And ultimately, by using the 2020 data, that inflated the perceived gap and the perceived demand, which helped push the narrative that we needed to raise taxes. So while Oregon Health Authority never surveyed our actual bed capacity, the Department of Health and Human Services did. In 2020, they performed the NSATS report, which is the National Survey of Substance Abuse Treatment Services. And that report indicated that roughly 23.4% of Oregon's recovery bed capacity was not being used. And that's the same year that the GAP report is telling us that we need double the beds than we currently have. And again, this is a sentiment that I believe we've heard mirrored by some of our, in this task force, by some of our recovery providers, when they indicated that they had capacity and that capacity was available, but only if you had private health insurance. We heard from our recovery providers that those patients on Oregon Health Plan were not able to access services because the reimbursement rate for Oregon Health Plan was so low that recovery providers could not afford to see them. And thus, there was long wait lists for Oregon Health Plan patients to get access because recovery providers were rationing those beds to OHP patients. And I believe that this likely is more the culprit of our lacking capacity than any physical lack of beds. Now, if we were to follow the recommendations of the GAP report, Oregon would need to spend billions of dollars on infrastructure alone. This report, and of course this proposal, does not address in any way the lacking access for those OHP patients. So any new beds that we're constructing would not be any more available to those patients than they are today. Now, if you look in the bottom on the left here, this is a screenshot from the GAP analysis report. And you can see highlighted in the red box there is the number of new workers that were estimated as needed to support the new recovery capacity. And below that, you can see the number of facilities. And again, this is billions of dollars worth of investment the state would have to make in order to accomplish. On the right, you can see this was a chart that was presented to us at a previous task force meeting showing the estimated workforce wages costs to employ all these new workers. And the corrections in red were mine because there was some mathematical errors there and there was some confusion. Ultimately, that resulted in that number being overestimated by $418 million. So kind of wrapping up this section, I believe a change in methodology was exploited to build a narrative of an addiction epidemic that the data did not support. The narrative was used as foundational in the conversation about increasing taxes to fund additional recovery capacity to combat the design epidemic. Our understanding of our lacking recovery capacity is not based on any real observations, only a theoretical model, which is known to have relied on flawed data. The methods employed in the GAP report are sound methods, but they were never intended to be used in a vacuum. The theoretical framework of the GAP report is best employed in tandem with real-world observations, so our actual capacity needs are understood, and the GAP report can be used to help identify holes in coverage, not as our sole guiding light. I fear we are striving towards goals that are not based in reality or supported by the data, and if achieved, would not likely improve access to the recovery services for those OHP patients who seem to be the ones who are lacking access today. So I wanted to talk a little bit about substance use disorders. As a statistic, the state's making billions of dollars of decisions with substance use disorder a factor. And I had conversations with a number of lawmakers, and while all of them were familiar with the statistics, none of them were exactly familiar with how they were being derived. So for the next couple of slides, I wanted to walk through alcohol use disorders specifically, and keeping in mind that all alcohol use disorders are counted as substance use disorders. And I also want to, a little disclaimer, a lot of the media I saw likes to conflate SUDs, substance use disorders, with addiction. And these rates, these numbers are coming from the National Survey of Drug Use and Health. It is not an actual diagnosis of a substance use disorder. You would have to meet with a mental health professional in person in order to be diagnosed. These are meant purely for statistical estimation purposes for public policy. So the National Survey of Drug Use and Health every year interviews a number of people. In 2021, in Oregon, they interviewed 1,278 people. In 2022, 966 people, for a total of 2,244 people combined over 2 years. And again, this survey tends to combine the data in 2-year segments to help increase the sample size that helps improve the accuracy. Now, the combined total of those 2 years comes to about 0.05% of the state's population. Or if you were trying to extrapolate that to represent 4.2 million people, our state's population, just under the minimum size required to be statistically significant, with a plus or minus 2% margin of error. Now, that 2% margin of error is important because as we look at this data, if we look at the current data set for alcohol use disorder, 2%, that margin of error represents Oregon being anywhere from second highest rate of alcohol use disorder in the nation to 20th. So the margin of error leaves us quite a lot of wiggle when we're actually talking about where we rank across related to other states. Now, of the 2,244 people who were surveyed, 12% of them were estimated as having an alcohol use disorder, which, given our sample size, comes to about 274 individuals. Now, those 274 people are extrapolated out to represent nearly 450,000 Oregonians. So every single person who is identified by the survey as having an alcohol use disorder potentially represents thousands of Oregonians. Now, given that our sample size, if 37 people answered the survey differently, Oregon would cease to rank one of the highest in the nation and would become one of the lowest in the nation in alcohol use disorder rate in our population. And so again, I'm not trying to belittle the data, but it is important to understand some of its limitations. So an alcohol use disorder is estimated by asking 11 survey questions. If the recipient answers yes to any 2 of those 11 questions, they will be identified as having an alcohol use disorder. If we zoom in a little bit, of those 274 people who were flagged as having an alcohol use disorder, the majority of them, 60% roughly, were flagged because of the following 4 questions. Had a strong urge to use alcohol, used alcohol in many times or in larger amounts or for longer periods than intended, spent a lot of time using alcohol, feeling its effects or getting over its effects, or needed to use more alcohol to get the desired feeling. Now, while answering yes to these questions may illustrate an unhealthy relationship with alcohol, it does not necessarily indicate that this individual is a heavy drinker or in need of any recovery services. In fact, the behavioral risk factor surveillance system identified that roughly 8% of our population is a heavy drinker, and that's 1 drink or more a day for women and 2 drinks or more a day for men. Well, that's 4% lower than the 12% that were identified as having an alcohol use disorder, which again, if you roughly, that would mean that probably a third of our alcohol use disorder identified individuals are not even heavy drinkers. And if we go back a slide, 450,000 Oregonians were identified in this data set as having an alcohol use disorder or an SUD. And because the GAP report is trying to find coverage of recovery beds for every, the more SUDs, the more recovery beds. And a third of those are not even heavy drinkers. That's potentially 150,000 Oregonians right there that we probably don't need recovery services. Now, so while the National Survey of Drug Use and Health data can be useful in identifying trends and where Oregon ranks compared to other states, the data is prone to inaccuracy and it has some serious shortcomings due to large margins of error, small sample sizes, and using the new methodology. The NIH criticizes it as having a high propensity for a false positive diagnosis of substance use disorders. This is why Oregon needs real recovery care usage statistics to compare to the theoretical model in the gap analysis report to ensure that the needs that we're modeling are grounded in reality. So I want to take a quick moment and take a look at some consumption data. First, we're going to take a look at some numbers that we've already seen and then talk a little bit about commodity consumption, because again, that impacts how taxes will be applied to Oregonians. So we've seen binge drinking and heavy drinking presented to us before, only these charts look a little bit different than what was presented to us earlier. What we saw earlier showed large increases in binge drinking and also large increases in heavy drinking. Only to get those charts, Oregon Health Authority compared data points of differing methodologies. Just like the survey earlier, you cannot compare data points from when you change methodologies. When you are using the current methodology, you can see that there has not been a significant change to either of these statistics in the last decade. And also keeping in mind that there's a plus or minus 2% margin of error on this data. So any fluctuations in the line are within that margin of error. So we've seen some of this information presented before. This is looking at historical gallons of ethanol per capita per year. And again, this is derived from OLCC tax records. So this is gallons of alcohol that are produced in Oregon or imported into Oregon. It doesn't correlate 100% to consumption, but I assume that there is a pretty likely correlation between alcohol produced in Oregon or sold in Oregon and then consumed. So we saw earlier presented to us what was in that red checked box, and that was showing that consumption has been growing steadily since 2011 until its apex in 2022 at the height of the pandemic. Now, what happened after the pandemic, we have not seen yet, and that's that 2023, you can see that as the pandemic ended, consumer behavior changed rapidly and consumption fell off a cliff. That's because we no longer had the pressures of, worrying about our loved ones. We weren't trapped in our houses. We weren't stuck, worried about the economy. Things were getting better. And across the country, this is not unique to Oregon. We're seeing this nationally as well. But because our data lags by a couple of years, a lot of regions in the nation are trying to push changes to legislation now with the goal of reducing consumption. But again, much of our goal has already been accomplished. If we do pass a tax increase, there might be an incentive to say that tax resulted in a decrease in consumption. But again, that decrease has already occurred. And our next data sets, I believe, will be much improved regardless of what we do in this task force. So again, we heard earlier that medically it's not important which commodity ethanol is derived from, whether it's beer, wine, spirits. Ethanol is ethanol to the body, and that's mostly true. But we're in this task force talking about taxation, and not all commodities in Oregon are taxed the same. All liquor is controlled by the state in Oregon, and thus is not privy to any of the taxes we're discussing in this task force. We are just discussing beer and wine taxes. So as we look at this chart, you can see on the red line at the top there, that's malt. And malt gallons have decreased by about 20% since 2010, and then dropping steeply, you can see in 2023. On the bottom, you see wine, that's that yellow line there, and it's been effectively flat since 2010. Where we see a difference is that blue line in the middle, and that's spirits. If we zoom in on that, you can see that spirits have actually grown roughly 38% since 2010. Now, if we go back 2 slides to this chart, well, if malt is flat, or malt is down, pardon me, and wine is flat, that means effectively 100% of the increase in consumption is attributable to spirits, which of course is the one commodity that this task force is not talking about taxing. Okay, so again, looking here at spirits specifically, the state has recently approved a $150 million expansion, and that will grow the state's ability to increase liquor sales. Now, to be clear, I'm supportive of that project for the OLCC, but I do think that it's relevant to this conversation, and we do need to be honest about our expectations. I know that we've seen a recent decrease in liquor sales, but earlier projections for that project estimated that the state would see another $450 million of additional revenue by selling that liquor. And if accomplished, you have to sell a lot of liquor to make $450 million. And if our goal was just to keep our per capita consumption rates flat, beer and wine sales would have to reduce 20% to accommodate that increased sale of spirits. So again, if we're talking about taxes to raise revenue, that's something that I might disagree with the policy, but at least I can understand. If we're talking about increasing taxes to reduce consumption, that's a bit of a harder pill for me to swallow. As a small business owner, effectively that would be taking my business and pushing it towards a state-controlled channel. Now, a couple of other data points I wanted to clean up that we saw earlier. One, we've heard that Oregon wine taxes are the lowest in the nation. This chart here is looking at the per gallon rates for wine taxes across the nation. And as you can see, Oregon ranks 26th in the nation for very, very average. In order to claim that Oregon had a low wine tax rate, OHA compared Oregon's wine tax to other states' wine taxes combined with taxes that were not wine taxes. And that was done in order to make it appear as though Oregon had a much lower wine tax than it did, which would, again, make the justification for increasing it, easier. Again, there's been some discussion that Oregon has not increased its taxes in a number of years, and that's correct. But the last time we did increase our taxes, we were so high that it has taken 40 some odd years for the rest of the country to catch up with us until the point where we are average. So again, perhaps in another 40 years, if we decided not to increase our taxes, we would become one of the lowest taxed lowest wine tax rates in the nation. This chart also we've seen presented to us, and this was a few sessions ago, and I believe that this chart was intended to insinuate that beer and wine are not paying their fair share of taxes compared to liquor. Now, again, if you take a look at the chart, there are some labels here, and the labels should tell you something. It says liquor revenue and beer and wine tax, and that should, clue that this is not an apples to apples comparison, and that's because liquor is controlled by the state. The state acts as both the distributor and retailer for liquor, and the combined revenues from those business activities is the blue section of the chart. Beer and wine is sold by private beer and wine distributors to private retailers like bars and restaurants. Well, each of those businesses pays taxes too. And if you include the tax revenues from beer and wine distributors and the revenues from alcohol sold from grocers, it turns out those revenues are as large, if not larger, than the blue section of the pie here. They just have a different name. So alcohol is heavily regulated in the state of Oregon, and in fact, one of the most heavily regulated states in the nation. And I think it's important that we touch base on kind of how alcohol is structured here in Oregon, because it has a big impact on how taxes pass through to the consumer. So first, the three-tier system. So designed after Prohibition, the three-tier system was intended to promote fair trade by keeping the three parties in alcohol production and sales separate. The tiers are producers, that's breweries, wineries, cideries, such as myself, wholesalers, that's your distributors, and retailers, that's your grocers, your restaurants, your bars. And no one tier in the state of Oregon can have control over both of the other two tiers legally in Oregon. A disclaimer, three-tier law is actually rather complicated, but from a 1,000-foot view, that's effectively how it operates. And again, liquor in the state of Oregon is controlled by the state, so it is outside of the three-tier structure. So when we talk about that, because of those three tiers, we've seen a slide similar to this, I believe, in last session. And this is just breaking down kind of where the margins go, because every time somebody touches your product, well, there's going to be a markup, and of course, they have to have their margin. So when we look at, I'm assuming a $9.99 six-pack, those were the good old days. But a $9.99 six-pack, that light purple area up at the top there, you can see is roughly the percentage of that shelf price that goes to the retailer. The light blue area in the middle goes to the distributor, and that light green area in the bottom is the cost of the supplier to make the product. That's your labels, your cans, your juice, the labor to put it in the package. And then the very bottom there, you see that little blue slice, and that represents the supplier's net profit. And again, it's not a big number of the shelf total sale price. Now, that red dashed box actually represents the size of the taxes that would have been imposed had House Bill 3312 passed. And as you can see, considerably larger than the supplier's net profit from that sale. So it would not have been tenable for suppliers to have paid that tax without considerable price increases on the shelf. And this might be a good moment to mention that there was never a study conducted on what the financial damage might have been on a tax like that to one of Oregon's largest industries. So I want to take a look, because of the way the alcohol is structured here. If you impose a tax on a supplier, that's called a privilege tax in the state of Oregon. That tax gets marked up first by the supplier, then the distributor, then the retailer. I have two models here. On the left is a privilege tax, on the right is a sales tax. Now, the sales tax is collected at the point of purchase, that's at the cash register. And ultimately, in these two models, the state gets the exact same tax, 25 cents, in both examples here. And all the parties make the exact same margins here, except when you impose the tax on the supplier, it makes the price higher. So in this particular model, it makes the cost $4.08 on the shelf compared to $3.30 on the shelf had it been a sales tax. And again, no difference to the revenue for the state, and all of the parties involved would have made the exact same margins. So really, a privilege tax compared to a sales tax is just a very expensive way to raise the revenue for our consumers. So Oregon is not the first place that's considered increasing taxes to control consumption. We have examples in many regions across the country, as well as internationally. And now that OHA was forced to publish the Eco Northwest final report, we now have also some models as to what that would look like in Oregon as well. So let's take a quick look at that. So we know that Eco Northwest modeled that a 2,444% tax increase would result in an estimated 5% overall reduction in consumption. But they warned that consumers would likely switch to spirits, lessening that reduction. And they estimated ultimately we could expect maybe a 1 to 2% reduction in excessive drinkers. In Illinois, they attempted a wine tax to reduce consumption, as was described in the Eco Northwest final report. And they were successful in reducing wine consumption, but malt and liquor consumption increased. And the overall per capita ethanol consumption reduction was less than 1% because of this substitution. In Maryland, a sales tax on all alcohol was introduced to reduce consumption. Now, a study there indicated that there was a 5% overall reduction in consumption. Unfortunately, I wasn't actually able to verify that using Maryland tax records. But what I was able to verify was, according to NSDUH, there was a increase in both binge drinking and alcohol use disorder immediately following the implementation of that tax, which does make some sense that, you know, you increase the price of alcohol, maybe people drink less, but on payday, it's party time. Lastly, in Scotland, they introduced a minimum alcohol pricing strategy there, and they did see an overall reduction in consumption, although the study there found that excessive drinkers reduced food and even housing spending to accommodate the higher alcohol prices, which actually exacerbated some of the medical costs of that particular demographic. And they found that the reductions in consumption primarily occurred within the responsible drinker groups. So lots of different ways to look at the problem, but ultimately, at least in my opinion, none of them terribly successful in reducing the group that we're most trying to target, which is our excessive drinkers. And a big issue there is substitution. Eco Northwest talked about this and said, effectively, if you increase the price of one commodity, then people will likely switch to another cheaper option. And they warned, in our case, that would likely be liquor, but they also warned that that could include drugs and even street drugs if prices became too expensive. Now, I actually did a survey in sunny Corvallis, Oregon, and I hit up the grocery store and found the cheapest wine I could find at $7.99 for a liter box. I'll tell you, that was a joy. And that came in at $1.82 per ounce for pure ethanol. Then I went down to the beer aisle and grabbed the cheapest malt liquor I could find, which was $2.19 for a 25-ounce can of 8.1% ABV, which comes to $1.08 per ounce of pure ethanol. And then I went down the way to my liquor store and found a bottle of vodka for $8.95, which comes to 88 cents per ounce of pure ethanol. So already, before any taxes are implemented, wine is already nearly double the cost and malt 23% more expensive than spirits if your goal is purely ethanol. And of course, any additional taxes imposed on beer and wine will just increase the delta and the motivation for that substitution. So ultimately, Eco Northwest said we should consider other pricing and tax strategies to target the most excessive users. And this conclusion, I believe, is largely why OHA withheld this from the public, because it contradicted their desire to increase taxes. And again, Eco Northwest said that it might be effective at reducing population level consumption, but really not terribly effective at targeting the group of people that we're trying to get to reduce their consumption. And when we talk about reducing consumption, we have to remember that reduction in responsible consumption is a reduction in our economy. Various tax proposals have been made with the goal of reducing consumption. Reducing responsible consumption does not achieve our stated goal of reducing substance use disorders. It does, however, damage our economy. The alcohol industry is a $17 billion industry in Oregon, and a 5% reduction would result in about an $850 million loss of business. And given the size, the scale of employment, roughly 6,000 people losing their jobs. The total economic damage resulting from this scenario could easily offset any revenue gains. from alcohol taxes. But again, no effort has been made yet to study what that might look like. So let's talk turkey for a minute. We've seen some budgetary numbers presented to us, and I think it's also important to take a look at some of our neighbors and see kind of how their spending relates, because there's some pretty stark differences. So first here, on the left is a chart that came from the Secretary of State's audit of OHA's handling of the Measure 110 fund. Included in that audit was an annual budget for SUD spending. And we saw a presentation a couple of meetings ago. I believe we were presented a budget of $974 million, although, at least according to the Secretary of State, that wasn't the current budget cycle. That was actually the previous budget cycle. The current budget cycle at the time of this audit was $1.14 billion. And we know that there's been several $100 million of additional funding since the audit was conducted. We now believe the budget to be around $1.4 billion. Again, that would be roughly 150% increase since the end of the 2021 budget cycle. So with over $1 billion in new funding since 2021 on substance use recovery funding, what metrics do we have showing improvement? And it's a bit of a rhetorical question. I know the answer is none, because we have no metrics. And that was one of the core criticisms of this audit, specifically to Measure 110. They said there's a significant risk that policymakers will be unable to gauge the impacts of Measure 110 due to poor data collection efforts. So where's the money going? Oregon ranks, the third most expensive state in the nation to obtain substance use treatment. And Oregon is also in the top 5 in per capita tax dollars spent on substance use recovery funding in the nation. I know there was some conversation earlier that perhaps it was so expensive in Oregon was because we defunded our recovery network. But even before we more than doubled our spending, we were still in the upper 25th percentile of spending per capita compared to other states in the nation. And we've heard from some of our recovery providers, that Washington is better resourced than Oregon, but Washington spends about a third as much as Oregon does per capita on their recovery services. So, obvious questions are, how are they better allocating those resources to achieve better results? And as we zoom out, Oregon spends more than nearly any other nation, or any other state per capita, and yet gets worse results than nearly any other state in the nation. I think there needs to be some serious work put into looking at what is happening and why we're having such an ineffective return on our current spending. And ultimately, that Representative Blumenauer and Governor Kotek convened a task force of a number of experts to review our spending. And the consensus of the experts they brought together was that money was not the problem. The problem is how we mobilize and utilize the resources we have. And I think a point that kind of exclamation point on that is we saw in a previous presentation, OHA presented that they were unable to account for roughly 6% of the total funding they spent on recovery use treatment. That's almost $60 million of unaccounted spending. Well, that figure happens to be nearly 3 times the size of the total current annual revenues from beer and wine taxes. So again, there is no scale of tax increase that can offset that kind of budgetary mismanagement. So wrapping up, House Bill 3296 and 3312 were both extreme proposals to increase taxes, both at the request of Oregon Recovers. We know that there was no research conducted to understand what the impacts of those taxes might be to the state and to one of the largest industries in the state. And we know from conversations in this task force that I don't believe there was an understanding of even the size of the alcohol industry at the point that those bills were proposed. OHA has publicized a narrative that used a change in methodology to make claims that were unsupported by the data. OHA has never conducted a physical audit of Oregon's recovery capacity. All statements regarding our lacking capacity are based on a theoretical model, which we know relied upon flawed data. OHA suppressed data that indicated taxes were largely ineffective in reducing excessive consumption. And again, OHA is unable to account for large sums of money, nearly $16 million from their previous budget cycle. And the sensible point is actually one that was fairly surprising to me. I believe in this task force, this point came up that recovery providers were unable to service OHP patients, and because of the low reimbursement rates. And I was rather surprised that point came up, largely from questioning from myself and others on the alcohol side of the aisle. And I would have thought that is the exact sort of barrier to accessing recovery services that I would have hoped that we would have been able to discuss in this task force, and I would have expected to have been presented by Oregon Health Authority. And lastly, we're talking about raising taxes, but again, we're doing it in a vacuum. I don't know, we haven't talked about how much we're trying to raise, and specifically what we're trying to fund. What metrics are we trying to improve? Because all of these questions will address what kind of taxes are reasonable, because ultimately raising taxes for the point of raising taxes doesn't really address the problems. And I fear that given the current allocations of our current taxes, with 97% of them not being earmarked for recovery services, that will be the fate of future taxes as well. So wrapping up.
Well, I think before we get to this, because we sort of came together as a group to talk about what potential next steps could be for this group, or what could be, as a very diverse group, figure out in terms of something that everybody could support. But I think maybe before we get to this, it might be interesting to stop, because Erin has presented a lot of data, and get some questions, perhaps. I don't know if there's any hands up or anything, but I'd like to hear, if this is, from other people's perspective, if there's anything that was missed in this report, because, this is, I'd say, our perspective based on the meetings that we've had in this group, based on the data that's been presented. And I want to thank Erin so much for really digging into the data to get to this. And I'd love to hear from experts, did we miss it?
Oh, there they are. Okay, before I call on anyone online first, I do want to be very, very clear about it. Erin and everyone, you are very, very aware that those two bills were never going to pass. You have to be crystal clear about that. You know that. And we've discussed that here. Obviously they were very, very strong proposals. And part of the intention was to get the alcohol industry to come to the table and have a discussion, which you refused to do. Nope, you didn't. No one called me, no one talked to me. I said, I asked, no one wanted to talk to me about it. Either here nor there, not at this point in time, because they were never going to pass. Never. That wasn't going to happen. It was part of trying to have a conversation. So it feels somewhat disingenuous to me to throw them out as a thing that says you were going to damage. This is how bad it was going to be. This is how horrible it was going to be. It also was very interesting to me that, the analysis of how many people were surveyed, the statistics that brought all of those numbers together. And yes, that 37 people on one side or the other of that small, minute number of folks that were surveyed would have switched the situation, but they didn't. And the fact of the matter is unless you're a statistician, the process by where you do that type of work of creating statistics and doing that type of analysis, there is no possible way to have a larger sample size sometimes. And so that's what we deal with. And that's the reality. And I get it. I get the piece certainly about the ethanol content and where people are looking for the ethanol. But I feel like it was almost somewhat disproved in a way in terms of that we maybe didn't have do we have enough beds or do we not? We don't have the ability to pay for the beds in the way that we should, because again, state of Oregon does weird things with its money. Hang on. We do weird things with our money, and we don't put it in the right spot. And in some instances, we have to bring in more resources to be able to do that. Okay. And then if people would rather spend more money on alcohol than food or housing, that says we still have a problem. It says there is an issue here. Not just here, but all over this country and all over this world about alcohol. If people would rather spend money on alcohol things or housing, and I will say as a service provider, not directly in alcohol anymore, but it used to be. We may not have the numbers to prove a whole lot of that, or these numbers may be squishy one way or the other, but many of us can see it every single day. So, lots of people online want problems.
May I address?
Certainly, take the.
Just you had said that, one of my, I think, core criticisms is that we lack any data on what is going on out there. And if our goal is to improve access, we have to know why people aren't being able to access things. We said we can't afford to increase our reimbursement rates. Well, that may be the case, but we don't know what it costs because we don't know how many patients are going to be in that scenario. We don't know how many beds are in use. We don't know how many beds aren't in use. We don't know wait times. We don't know where things are problematic and where things are okay. I mean, without these vital, baseline statistics, we can raise money and we can put money towards it, but I just don't know how effective it'll be without a plan.
And I think we have some answers there. I'm going to start with who's number one, Rob.
Thank you. Super good report. I'm really interested in seeing response by Oregon Health Authority, some of the points that you raised. So I really appreciate the time that you took to put that together. Question, one of your slides shows when you cited efforts in other states and in one case a nation who raised rates, taxes to impact consumption, and what that slide showed is that the impacts are negligible or very little impacts.
Yes.
Then another slide that you showed the tax being a sales tax compared to the privilege tax.
Yes.
Form. And so if the state of Oregon was going to raise the tax, which I know that the industry is concerned about the impacts of what that would do to your industry. But if they were going to raise a tax, I would assume that based on the report that you gave me, the least impactful would be if it were taken at the cash register rather than the privilege tax. Is that correct?
Yes, that's correct.
Thank you.
Sorry, Solara.
Solara Salazar, thank you. First, I just want to acknowledge, Aaron, I really appreciate all the homework you guys did, or that you did on this, report and looking into treatment center data and, the issue. It looks like that took a lot of time to compile and research. And as somebody that's not an expert, right, in our side of the field, I appreciate that that you are researching that. Just a few little points I wanted to bring up. One is, where you talked about for alcohol use disorder, the questionnaire they use. So I am a CADC, so I can diagnose substance use disorders. I've been doing it for years. And the 3 questions they asked are the top. Those are the 3. Like if people are answering those, unequivocally, they have a substance use disorder, whether I am checking off the boxes or somebody's checking them off themselves. So those were really good questions if you were going to ask on a survey for individual alcohol use disorder. And then another thing I really wanted to bring up was the gap analysis. I know you said a lot of it was theoretical, but as a treatment center provider, we participated in the gap analysis, and it was a very lengthy process. I want to say I did over a 2-hour interview where they asked every question you could imagine about bed capacity and wait times and services provided and length of treatment. Some of it was so intensive, I had to tell them I had to call them back because I had to pull our data and I had to do some more research to get them, the accurate numbers. So I do disagree with the fact that it was theoretical, because in my experience, it definitely was not. I had to put in quite a bit of work to contribute our piece to the gap analysis. And I think one of my biggest frustrations, because I have been fighting for funding for so many years to help people that are suffering, is every time we come to the table, we're told, well, this study isn't sufficient. We need a better study. And you know what? You're right. The gap analysis, there was a few things I would have liked to have seen, like health insurance, right? Like, was it private? Was it Medicaid? So yes, I believe there were some gaps in the gap analysis, but what I struggle with is that why we wait for another study. I am on the phone with a woman who's living in her car and sobbing and crying, and her baby's about to be adopted out by DHS, and she's begging for help. And I don't want to tell her, well, don't worry, they're going to do a study in a year, right? And then maybe that study will show that you actually need help and that there's actually not enough services for you. And so it becomes very emotional and challenging for me when we're getting flooded with calls of people that we cannot help, and we cannot get into residential treatment, and we cannot get into detox. And we're just always told, it's like, we need more data, we need more studies. And we know we need more beds, like we need more funding. And yes, Medicaid rates should be increased, but that takes money, right? That doesn't happen in a vacuum. And so we're back at the table once again saying, yes, like we do need these things. So, but thank you for putting all that together, because I do appreciate how much effort that took to learn about our side of things.
Thank you. And if I may respond quickly. Sure. And Salazar, again, thank you. Solera, sorry. I'm sorry. Thank you again for your contributions. You've actually helped me understand how billing works in your industry. And I think it's been eye-openingly complicated. I will note, though, that the GAP report, and I'm well familiar. I've read through the survey, and it is extensive. It is a big survey. But what the things it did not ask were anything related to wait times or bed usage rates. So it asked, what services were provided, but it never asked any questions about, how many people are turned away, how long are the wait times to see a patient or see a specialist, or what percentage of the beds are being used. Yeah, and ultimately, I'm here to help. I know I hear your frustration, but I want to find a way to get funds to your business, and I respect what you do. I want to see people helped, but at the same time, again, I also have a small business, and I need to protect my people too. And I want to make sure that we have a plan with where the money's going, and that it's going to be used effectively. And the data, as far as real world data, like I said, we effectively have none. And it's not, I understand that this gap analysis report asks questions, but we know nothing about where to even put, what regions of the state need help. We don't, maybe Annalise, can you?
I'm shocked to hear you say that, but okay.
Okay, you feel that? You feel differently?
Because
yeah. I'm also responding to your comments that meetings ago. You said that you had such little data.
I do have such little data, but can I jump in? Are you going to wait? Just on this one piece, please. I have responses about the gaps analysis and what it was intended to do. And OHA did come to present, and maybe it just wasn't in detail, but there is a facilities gaps analysis. I want to be careful, like we're all throwing around different terms here. Like you're using recovery, which in our world means something very different than treatment, than prevention, and harm reduction. So I just want to acknowledge that for all my folks out there watching. But we do have a facility analysis now that tells us where we can actually look at the SUD facilities that we need. And I'll talk later, I agree with you 100% that we don't have the data we need, but to say that we don't have any data and to completely minimize the need in our communities, it hurts. Yeah, it does. So I'll just say that.
Thank you. Thank you. Dr. Jean.
Thank you. Yeah, Tom Jean, OHA. So yeah, thanks for the presentation, Aaron, and definitely kudos on the details. You did do a lot of work. There's really far too much that you presented that I could even respond to in a minute here without doing a whole presentation of my own. So yeah, obviously a lot of work. I do think you were really focused down on details in your presentation. And I don't want to say that details don't matter, because they absolutely do, but I think it's missing the bigger picture. And the overall picture from multiple data sources is really quite clear. We have multiple indicators of excessive alcohol use that are increasing, and some are stable. There are a few that are going down, like youth use. But overall, we want those all going down. And I'm talking about excessive alcohol use. I'm not talking about, quote unquote, responsible use or low use, moderate use. So, and then we're specifically regarding the NISDA, OHA is well aware of the NISDA and BRFIS methodology changes. We had email correspondence with you on those. We've gone out of our way to highlight them where appropriate. And so those are a limitation for drawing, conclusions about some of those specific indicators over specific time periods. But I will point out that post methodology change for the NISDA survey, which is the National Survey of Drug Use and Health, compared to other states, Oregon is in the highest quintile for alcohol use disorder, based on the questions they ask, which do track pretty closely to the DSM-5 criteria, which is the gold standard for how we define alcohol use disorder. That said, it is a survey that we're asking people these questions, so it's not the same standard as a medical diagnosis, but it's trying to get at the exact same issue. Secondly, the alcohol is a product subject to sales tax in most states, and so whether a tax is called a sales tax or an alcohol tax, I think this is something the task force will have to discuss, but the total tax on a product affects the total price, and that in turn affects the economic effects and the behavioral effects. So when you factor in Oregon's lack of a sales tax, you'll see that we're very, very close to the bottom, if not the absolute bottom in those taxes. So I understand you see it differently, but I think that that's a very defensible way to look at that issue. And then finally, on the Eco Northwest report, just wanted to make a correction there that OHA did not withhold data from the public. The data from that report, the final report before it was published, were used in public messaging, specifically our Rethink the Drink campaign, as well as in our strategic planning and prevention program work. The report was a report commissioned by OHA to OHA. It wasn't originally meant to be a public report, but we did apologize for the delay in the oversight and not publishing it in a timely manner. And we're very happy it's out there, including the second part of the report on taxation and pricing strategies. That's important information. It wasn't something that was intended to be withheld. So just, responding to a few of the bigger issues there, I think, we'll have to, as a task force, discuss some of these things again in more detail. But I just felt like I had to respond to a few of those right now. So thanks.
Thank you, Dr. Jean. Rob.
Yeah, thanks for giving me another bite at the apple. When Solara was talking, I was reminded of one of the slides that was presented showed a national report that shows that 24% of the capacity in Oregon for treatment went unused. And yet, I think we hear over and over again, there's huge demand for treatment that's going unmet. Is the report, have things changed so dramatically in Oregon from then to now? Is the data not accurate? Is there crossover with addiction for alcohol and addiction for drugs? Solara, what might explain the discrepancy between what the capacity was then, which I think was 2022, and today, which is we have a waiting list that's too long?
So that's a very, Solara Salazar, thank you. Thank you, Rob. That's a complex question and a complex answer. I can give you a couple factors. I mean, I can't sit here and say, oh, this percentage is this and this is that. I can just give you my kind of high in the sky opinion. A couple factors. One, if we're looking at Medicaid beds that are going unused, it's a factor. There are currently residential and detox facilities that don't have staff to actually staff the open beds. And so you might have a facility that has 24 beds, but they only have staff to man 12 of them. So the beds are open. I mean, there's beds, but if you don't have staff, you can't take clients in. That's one factor. Another factor is that the criminal justice system often will have allocated beds, right? So if you have drug court and you're working with a residential treatment facility, you're going to have a set number of beds that are kind of allocated for that. And so if you're not getting as many folks into drug court, maybe those beds aren't being utilized from the criminal justice system. And then, yes, some of the beds as well are treatment facilities that can't exclusively take Medicaid clients because of the Medicaid reimbursement rates and need to offset the costs by reserving beds for folks with commercial insurance. So, and there could be other factors. Those are just the top three that pop in my head when I think about, unused beds.
Thank you.
So I do want to thank you.
I'm sorry, your name again?
Sorry, Gail Stahl, Director of the Alcohol and Drug Policy Commission. Really want to reiterate, so appreciate Aaron taking a deep dive on the data. He spent time with my research analyst. I say it again and again, we are all about transparency with the data. So I think it's my comments and my reaction before, I think are really encouraging all of us not to be looking at this so black and white, right? So I want to reiterate a couple of things that Aaron said, just that, we cannot rank states. SAMHSA has put that in writing to the states. So I heard Dr. Jean, you yourself referred to the quintile we're in. Yes, you can look at kind of where we're at in the states, but that information is not for ranking. It is also just reiterating what everyone has said, the importance of the survey data is not for us to say, oh, we have exactly these number of people with this diagnosis. It's how we measure our progress over time, which is exactly why you can't compare the NISBA data. That is 100% true. I've emphasized that over and over. No reason to believe that our substance use disorder rate has doubled. We also have no reason to believe it hasn't. So that's the piece I really want to emphasize. And all the qualitative data that we have says that we're not in a great spot right now. Now, does that mean that we should all be saying we're the worst in the nation? No, that is probably a gross exaggeration. And others may disagree with me on that. The CAST, the OHSU GAPS analysis. So I do want to throw out that we do have updated data. The facility data from OHA should show us on just adult facilities. The OHSU GAPS analysis was really never intended to be a precise count by region. They use SAMHSA data, so those should be all licensed beds. It's true they didn't get data except from what they could get from providers. OHA didn't actually give them a lot of data. It was the SAMHSA data and the providers. Often overlooked in that study is the survey portion that Solara was referring to. There's a ton of amazing data in there about our travel barriers, lack of referrals. We might not have wait lists, but the lack of referrals. But we also don't require providers to keep wait lists. We don't require them to report out on the number of open beds. We don't have a process right now to go region by region and count those beds. So data is a problem. I'd like to push back on the conclusion that it means there isn't a problem. My question that I'll put to all of you, and I thought of it in your Let's Talk Turkey section. When you look at who consumes the most, and this was alluded to in the Eco Northwest report, right? And where I sit, where we really need to get to is taking that top slice of people, right? The really heavy drinkers. If I could wave a magic wand and get them to stop drinking that much. But if we do that, by whatever the magic wand, I'm not saying the tax is the magic wand, I think don't let the end doing it, but if we did it, your sales still go down. So like this, so my question for you guys is like, what is our common grounds that like none of us want people to have severe alcohol use disorder. None of us want kids to drink, right? None of us want heavy drinking. I don't know how to, like, even if we could wave a magic wand, your sales are still going to go down. I'm just going to say that. Like that upper portion drinks so.
What is the question though there? I mean, you could say that about a donut shop or something too, right? Like if we're trying to deal with obesity.
Well, I guess my question to you is like, I mean, do we have, I guess overall, do we have any common ground? Like at what point are we partnering? Right? It's one thing to say, of course, we don't have obese disorder. But if at the end of the day, you don't want your sales to ever go down.
If I may address, I think I can get 110.
Sorry.
Oh, who am I? I don't know. Aaron started off 2 towns.
Thank you.
Oh, I appreciate it. I know it's easy to forget. And first, I want to say I apologize that I didn't intend to belittle the work that we have and the data that we do have. I'm not trying to say that. I'm just trying to say, financial framework. If I were running my business, I would have a hell of a hard time doing it with the data that's available. I mean, I couldn't make the kinds of decisions I need to run my business with what I have available from what I've researched. And that scares me because it's a lot of money that we've got moving around. And like, I wouldn't be comfortable doing those kinds of things, for my business with that kind of information. But as far as common ground, I think education is where I can get 110% behind that. I heard in a previous task force, there was a suggestion for an education curriculum for vendors and producers of alcohol to train and identify for substance use disorder, so that we can help identify, like, or train our bartenders. This is a person who's a problem drinker. You can identify them by these traits when they walk in the door. And these are, some things that you can do to help that person not overconsume, today. Similarly, I think we need some data collection requirements. And my industry, I have a ton of requirements that I have to report, and it doesn't matter if you're a mom and pop, one person brewer operation or a big national brewery. It's the reporting is quite complicated, and there's a lot of it. But because of that, it makes data collection. The data is much, you can do things with it. And I think that we need a unified vocabulary so that we can catalog our treatments the same across the state. I think we need to require providers to have a base, level of reporting that they want to do, that they have to do in order to get, funding. I mean, I think that I'm cognizant and sympathetic to all the work they're having to do already, but without that, I don't know how we get to where we need to go.
You had a question, and then Tom on the line. Todd, sorry, go ahead.
Yeah, Jamie Floyd, Ninkasi Brewing. I've got 2 points, and they're kind of related. So if I could, the first is just, Chair Sanchez, I know that I appreciate you saying that you propose those taxes to get us at the table, but as a 25-year member of the Oregon Brewers Guild, I can tell you that we have never been invited to a single table before a tax increase proposal or after. And every single tax increase since I've been a part of it has been more than the last proposal that was then turned down by legislators or voters for other things. And so I guess for me, it doesn't sound genuine to say that we never wanted to be at a table. We literally never been asked to be at a table. So this is literally our first chance. And the reason that's important is, even if I may have known that, our bankers didn't see that way. And for all of us that are in the profit sphere, we actually are responsible to the bankers that we took loans, which is very similar to the taxpayer or to us as tax revenue generators for the state. If I were to take a dataless proposal to a bank to show how I'm going to save my business or turn things around, I wouldn't be in business. We would be closed. All of our employees who have benefits, that include health benefits, that include treatment, would potentially be a part of a bigger burden in that OHP number versus that. So it is sensitive for me. We do feel triggered when we see every year it comes out more. And then in between that time, there's no discussion. And I've talked with lots of legislators throughout the years about this. And it's thrown that way that you don't want to be at the table, but then there's not really a table. So I first wanted to say I really have appreciated that this task force is here. I've learned so much. And I think we have so much more common ground than necessarily that this process is facilitated. So just really wanted to say that. I really enjoyed, to the degree we can enjoy this. This is something that I think any of us go home and say, wow, I really enjoyed it. But the perspective has been really important to me. And the problem is bigger than the size. This is a really big problem. And it's just I work a lot in nonprofit sphere as well. And it's hard to understand the difference if you are betrothed to a bank versus, a scholarship fund or some other, money that comes in that way.
Well, so let me just say, of course, I have talked to Danelle and I have talked to Vaughn, but the larger group of folks, yes, I tell everyone you're welcome to come and talk to me, but if you talk to other legislatures and you didn't talk to the big bushy one.
I think over the years.
Okay.
I'm not in any sort of time limit. I'm just, there's been different legislators that have been taking your gavel.
Right. And I'm definitely the pushy one on this and have been pushing since 2018 when we kind of re-upped the Alcohol and Drug Policy Commission to do what it needs to do. So.
Chair Sanchez, I will just say Fidel Romaine, Fair and Wine Distributors, I have enjoyed spending time with you that we had not spent together before talking about this issue. And while I think we both really fundamentally disagree on the tax issue, which is okay, I think we've had really important dialogues on the larger issue. And I think I do not, I don't want to kind of vilify you for those tax bills that were introduced. And I don't think you had negative things to say about the industry, but what it did is it allowed other groups to say very negative things about the industry. It perpetuated a really negative dialogue in the media, in the legislature, and it was really ugly. And so I think that's what people are feeling is that when that stuff comes out there, while it was not you, it did allow others to, I think, run away with the message.
I can appreciate that. And I will say that part of the reason I started our very first meeting with, owning that opening salvo and owning the fact, I think, to try to say, we're here to get this done together. We are not, it's not like we're going to walk away. People keep asking me, will you have open for 25? And I have no idea because we have not gotten to the place where we can discuss that yet. Or we can come up with an idea, which is why I think your question is certainly hugely important. Where's the middle ground? What can we do differently? How can we shift something? And it's not nothing. It has to be something. We have to figure that part out. So we'll keep moving forward with that conversation. And Todd has had his hand up for a little bit here, so I'm going to let him speak. Todd Jeter.
Thank you. I appreciate the floor for a moment. Todd Jeter, Behavioral Health Director with Samaritan Health Plans and IHN CCO. I'd like to share both from the CCO perspective and also I'm a person in long-term recovery, worked throughout the behavioral health system in Oregon, community mental health in the Gorge, former clinical supervisor for Willamette Families Residential Program in Eugene, former residential director for Central City Concern in Portland, former multi-site federally qualified health center director for primary care clinics on the Oregon coast. One of the things that comes to mind as I'm hearing all of this is kind of a disconnect between, I think, between the sort of high level conversations that we've been having and what's actually happening in the lives of Oregonians that are looking for addictions treatment. I remember very clearly, this was back right before the pandemic in 2019. I brought a group, I was the residential director at Central City Concern at that time, and I brought a group of women from our women's inpatient treatment center to the Capitol for an advocacy day at the Capitol, or Recovery Advocacy Day. And I took myself and some of the treatment staff, took the women into different representatives' offices and things to talk about the importance of recovery. And I remember very clearly taking this group of women who were fighting for their lives in recovery, trying to get their children back from child welfare, bringing them into a representative's office, and there was cases of alcohol stacked up about chest high, where the alcohol industry had been meeting with the representative, and these I guess were gifts of some sort. It's very hard to justify that, though, as a person in recovery, bringing other folks there to talk about recovery and looking at cases of cans of alcohol, from the I guess that goes to the point of just saying that alcohol, the difference between alcohol and other substances is that alcohol is the substance of the ruling class. And there is
you're cutting.
Did I miss something?
You're cutting out.
Oh, I'm sorry. If I can rejoin. Can you hear me now? I can switch over to another computer.
No, you're fine. You're fine right there.
Okay. So I was saying, alcohol's the substance of the ruling class, and that's why we're here having this conversation about taxes today. It hasn't been raised in many years. I've heard a lot about how alcohol helps the economy. It also uniquely causes a cost to Oregonians. It causes a cost to the economy that quite offsets. When we're talking about restaurant workers and we're talking about the brewing industry, I know a lot of people personally and through treatment services who are from those industries. I know of folks in brewing that because they're taste testing the alcohol as they're brewing it, they've developed, they feel like they can't do their job and stay away from alcohol, and they've had to go into detox. And restaurant workers, gosh, tons of folks in the restaurant and the hospitality industry, because they are exposed to alcohol every day. They've had problems with alcohol. They have to go into treatment. So it's not just a benefit to those groups. There is a cost to those groups as well. It's not that, we're not talking about taxing a flower bouquet shop. We're talking about taxing an industry that is selling a product that is contributing to cost and contributing to harm. I don't want that to get, some of the more simple facts to get lost in all of the big numbers pieces. Why is there shortage, or what are the problems with access? Well, one of the big problems with access is access to detox and residential, the highest levels of care. Part of that, it's a multifaceted problem. We definitely all have to work together as CCOs, OHA, and legislators. It's not just the tax dollars, but having funding is certainly part of it. Right now, the resources that are available have become increasingly localized resources. The person that is in Eugene on the street or in Portland on the street is going to get into treatment much quicker than the person that has to be bused 3 hours from the Oregon coast. And so the beds aren't available for our folks who are in the rural areas. They've become metro resources, which is where they're primarily located. That's one issue. For CCOs, as we're trying to problem solve this, one of the things is that there are limitations around our dollars and how we can invest those. So if I wanted to do something like take funding out of our share initiative funding and reinvest it in developing a detox center, I can't do that because I can't purchase real estate or give money to someone to purchase real estate for that facility. To me, if you want to draw a direct line with alcohol, I would draw that line to detox. Right? If you're going to say, well, how would these dollars be used or specified? Use it to build detox facilities, because alcohol is the single most deadly substance to withdraw from. It costs the most to withdraw people from. And the main reason that people who are struggling with severe alcohol addiction are not getting sober is because they can't do that without medically managed withdrawal. And increasingly, that level of service needs to be connected to the hospital level of care. So a lot of issues, a lot of creative ways to try to solve them. But for me, the black and white, the getting down to what is foundational. What's foundational is there's not enough access to detox. Alcohol withdrawal is the number one case of needing the highest level of detox. And there's an opportunity here, I think, to do something that is fairly common sense and raising a tax that hasn't been raised in 40 years and dedicating that to building some more detox centers to create more access and to I guess I'll close with that.
Thank you. And Rob, one more time.
Yeah, excuse me. The group, based on the comment that was just made, detox and the need for access to treatment. But one of the things that's confusing to me is it seems like we're focused on explaining the carryover between addiction of with opioids and narcotics and alcohol. We're spending a lot of time focused on the alcohol aspect of it, and I know that that Measure 110 and the way that tax money was built up in Salem to provide treatment, I would assume that those resources are going to help people who are addicted. That the treatment with some little difference is very, very similar. A treatment center for someone with alcohol and somebody with an addiction to narcotics. I think hasn't the state massively increased access to funding for treatment for narcotics through Measure 110, but that doesn't seem to be taken into account here. Am I wrong?
I wouldn't say massive. I would say there's been an increase. There's certainly been Measure 110 funds have been sort of deployed to do mostly like sort of recovery services. I think there have peer supports, outreach. There have been some facilities that were detox centers, small detox centers that were funded, but overall treatment beds not necessarily because of how difficult they are to sort of source and manage and do the whole thing. And then that the Measure 110 funds were, in fact, of course, very tightly pushed around substances rather than alcohol specifically. So that part was very, very clear from. Yes, sir.
At least according to the Secretary of State, it appears this budget cycle is $253 million.
Yes. Yeah. Yeah, and that's statewide. So, yeah.
I was just gonna say, we have one last slide that's positive and about maybe some ways that we can work together. So I just want to make sure that, and we should get through whatever people. Yeah, I got that.
Okay.
Yeah. Well, just so there is one more slide.
Okay.
Yeah.
What's the one more slide? Okay.
One more slide.
One with the pretty colors.
Yeah. It's really just some ideas that we came up with as a group about maybe ways to find consensus in this group. So a place to go. And a lot of it was covered today by Aaron, but data collection, and go there.
Oh, just data collection, I think, is first and foremost. I know that there's an urgency and we need to get help to people, but I can't just reiterate enough that, again, as a business owner, we measure every single point along our bottom line, and I can know which shift has a downturn in productivity, so that way I know it's not the equipment, it's one particular employee that maybe needs more training, and that level of detail allows my business to be successful. And I think ultimately that kind of data analysis is why Two Towns has been successful.
Okay, so I want to just push back very quickly and remind you that we're talking about human beings, not a product. And no. Human beings are vastly diverse. And alcohol affects multiple human beings in many, many different ways. And I want to also just note, and Laura mentioned sort of doing assessments on an ongoing basis. When doing assessments, we know very well that someone in active addiction is going to tell us something different than it's actually going on. So it's just, I just want to say that very clearly, that it's very different than doing an analysis on business. You have to be really clear about that.
And again, when I say data, I'm not talking about the individuals so much as what are the rates that we're using our assets, where are assets available. For the cost of one recovery bed, for instance, you could bus roughly 2,000 people to another facility. If that's, that could be an option, just as a low cost option for a temporary patch. If you find that we have a spike in Portland, then maybe, Salem has capacity. If we actually tracked what our capacity was, that might be somebody that doesn't have to sit around on a waiting list. And we might be able to take that person and move them to Salem for a fraction of the cost of what it would cost to put one more bed in. And that's just the kind of analysis that I'm talking about, not individual people that I'm trying to analyze. The next up was, I believe, an audit. It would be very helpful. We've heard you said, I think, that the budget is like a tangled bowl of spaghetti, and I believe that. I can't believe how complicated this has gotten. The more we dig, every layer, you're just like, oh, geez. And this is what I do in my evenings when my wife watches television, as I go through tax records and things like that. It is brutal. So, but I do believe that as uncomfortable as an audit is, that I think that there's quite a lot of money that we can at least identify that way. And having that there, I think, gives us at least a baseline for where we can potentially move things more effectively. A plan, a financial plan, that's just a roadmap. Again, with some of the data, we can start to make hypotheses about what it is we want to do. If we're trying to reduce, get people more access, well, what are the top 3 things that are blocking their access to recovery services? And what can we do to individually affect those? And how do we measure them along the way to make sure that it's happening? And, that builds a plan, and then hopefully that plan has costs and things associated, and we can then determine what we need to spend to make it happen. And then lastly, an impact study. I'd like to throw some work to the OLCC. Lucky. I'd like to ask you guys if at some point, if you'd be willing to conduct an impact study that focuses on the tax-related economic potential harms to the industry and the state's economy. Because again, the last thing we want to do is impose a tax that ends up costing us on the other side, robbing Peter to pay Paul. And the last one, we would love to set up an inventory of existing drug and alcohol prevention programs and a statewide curriculum that we can actually start working together and have a unified set of tools. So as producers and vendors, we can train our people as best we can. I would love to see a training program, an official program that we can send our people to, like a certification, if you will, that we could start using to train our people up so that they can, because we always
Very hard to do certification.
Well, college questions.
Well, I think just to add a little color, one on education in the schools. Obviously, there's a lot of curriculum that's been mandated by the legislature. I don't know if alcohol curriculum has been mandated. I know you have with fentanyl under 110 and what you just passed, or maybe Annalise will correct me. Legislators have told me that was done and that way it was fairly cheap to do, but I know Annalise and I have talked about this. Anyway, it seems like this could be something maybe we could inventory and get, and like that it might be low hanging fruit. One on the education side. The other is anyone in the alcohol space has to be licensed, and that happens here via the OLCC. So there is already a process. Things can be easily and cheaply added. Cheaply, I mean relative to other things, to the program. So we thought it would be, it's again, almost like low hanging fruit in those spaces and something that could be really productive.
Todd, if it's very, very brief, because we are at time almost.
Yep. Got it. Very brief. I'll just share that the data in our region shows that access to lower levels of care is going down as the severity and frequency of use is going up. And that while we've increased access regionally as a CCO, Our numbers are going down because still a larger number of members are forced to go out of area for treatment, and the out of area access is becoming more localized. And year over year, our members have lost access to those metro area places of care, as the need has also gone up in those areas and they've become localized resources. As far as someone, it's not a matter of just shipping someone from Salem up to Portland or this or that. The resources are tapped. And what happens when you send someone out of their region to go to residential treatment is you're taking a very vulnerable person, usually very low income, if any income. You're sending them out of their community where they're getting discharged out of their community. And that's contributing to the homeless problems in Eugene and Portland. It also is poorer outcomes when they're not recovering in their community. So the answer is not just, shipping them around the state. The answer is building adequate access in the rural and frontier communities.
Thank you.
Chair Sanchez, thank you. Janet McKamey with the Oregon Wine Growers Association. Thanks everyone for listening today, to Aaron for all the work that he put into that. I think what we're hoping is, based in the statutory mandate for this task force is to look at things beyond a tax increase. And I think, we're looking at different sides of this. We can all get in kind of our defensive mode, like there has to be a tax increase, there cannot be a tax increase. And what are we missing in the middle? And so, I know I can be guilty of that. I think everyone can say, wait, I'm trying to, help protect my people who I know are working really hard and contributing to the states and really care about their communities. And I think we are missing things by, focusing so much on the tax piece. If we can at least reflect in ourselves and say, how does that move the needle? If we have an incremental amount of money additional, how much is that going to move the needle? And yes, you can say, well, haven't increased in 41 years and any amount helps. But truly, reflecting what are the things that can actually move the needle for us as a state and get that conversation going as opposed to tax increase, no tax increase. So thank you for the opportunity.
Absolutely. Okay, reminder, folks, our next meeting is Tuesday, May 28th, 1 to 3 o'clock in Salem. Do we have room?
Yes, here you'll be very familiar with the room. It's hearing room F.
Fabulous. Okay, hearing room F on the 28th. Your presence in the room. We appreciate it. Thank you so much. And with that, we are adjourned.